Hey there, science fans! Welcome back to another thrilling episode where we dive deep into the wonders and sometimes the dangers of science. We love a good explosion, right? There's something inherently fascinating about the sheer force and energy released. Whether it's a volcano erupting with molten lava or a rocket launching into the vast expanse of space, there's something mesmerizing about that raw power and the spectacle it creates. But what happens when that explosive power is unleashed a little too close for comfort? When the line between awe and danger blurs? Specifically, what happens when a firecracker, meant for dazzling light shows and celebrations, detonates in the palm of your hand? The results can be catastrophic. You know me, I'm all about the wonders of science, the beauty of chemical reactions and the marvels they produce. But today we're talking about the serious stuff, the darker side of these reactions when things go wrong. We're diving into the science behind firecracker injuries, and trust me, it's not pretty. The damage can be severe, leading to long-term consequences. Our goal? To understand the risks involved and learn how to stay safe. Knowledge is power, and safety should always come first. So buckle up, because we're about to explore the explosive and often dangerous world of firecrackers. From the chemistry behind them to the safety measures you should take, let's get to it. Firecrackers. They are often seen as symbols of celebration and joy, lighting up the night sky with their vibrant colors and loud bangs. But they're more than just noisemakers. They are small, controlled explosions that can be both fun and frightening. These little cylinders pack a punch, using gunpowder and a fuse to create a mini explosion. The process is simple yet powerful. The gunpowder, when ignited by the fuse, rapidly burns, producing hot gas. This reaction happens in a split second. This gas expands rapidly, creating pressure. The speed at which this occurs is almost unimaginable. The pressure builds inside the firecracker's casing until boom! The anticipation of that moment is what makes firecrackers so thrilling. The casing can no longer contain the force, and it bursts outwards, creating a loud bang and a flash of light. This is the climax of the firecracker's journey. Now, this explosive power can be controlled and used safely in professional fireworks displays. Experts take numerous precautions to ensure safety, but in the palm of your hand? That's a different story. That's a recipe for disaster. The same force that entertains us can also cause severe harm. The same force that makes a colorful firework burst in the sky can cause devastating damage to the delicate structures of your hand. Always handle firecrackers with care and respect their power. Think about everything your hand does. You write, you eat, you play, you interact with the world. Our hands are marvels of engineering. With 27 bones, numerous joints, muscles, tendons, ligaments, nerves, and blood vessels. This intricate network allows for incredible dexterity and sensation, but this also means our hands are vulnerable. Each of these structures, the bones, the muscles, the nerves, can be damaged by the extreme force of a firecracker explosion. Imagine this, a firecracker explodes in your hand. What happens? First, there's the heat. The explosion releases intense heat, causing immediate, severe burns. The skin is instantly charred and the pain is excruciating. We're talking third-degree burns that can damage all layers of skin, requiring extensive medical treatment. This isn't just a surface burn. It penetrates deep, affecting the dermis and even the tissues beneath. Next, the pressure wave from the explosion tears through your hand. The force is so powerful that it disrupts the normal structure of your hand. Soft tissues like muscles and tendons are ripped apart. Blood vessels rupture, leading to significant bleeding and swelling. Nerves are severed, resulting in numbness, tingling, or complete loss of sensation. This nerve damage can be permanent, affecting your hand's functionality. And then there are the bones. The force of the explosion can easily fracture or shatter the delicate bones in your hand. The intricate structure of your hand is compromised, making it difficult to perform even simple tasks. The blast can also send fragments of the firecracker casing deep into your hand, acting like shrapnel, causing further damage. These foreign objects can lead to infections and complicate the healing process. Immediate medical attention is crucial. Surgery may be required to remove shrapnel, repair damaged tissues, and restore some functionality. The road to recovery is long and painful, often involving physical therapy and multiple follow-up treatments. Section 5. From chaos to care, emergency response and treatment. After a firecracker injury, immediate medical attention is crucial. The scene is often chaotic. There's pain, bleeding, and the smell of gunpowder. The first responder's priority is to control bleeding and stabilize your hand. Then, you're rushed to the hospital. The medical team will assess the damage, clean the wounds, and determine the extent of your injuries. Pain management is critical, as firecracker injuries are incredibly painful. Section 6, picking up the pieces, surgery, recovery, and rehabilitation. Depending on the severity, surgery is often required. Surgeons may need to remove foreign objects, repair damaged tendons, or even amputate severely injured fingers. Yes, you heard that right. Amputation. Recovery from a firecracker injury is long and arduous. It involves wound care, pain management, and physical therapy to regain hand function. Even with the best medical care, some individuals may never regain full use of their hand. Section 7. Safety first, fireworks second, tips for a safe celebration. The best way to deal with a firecracker injury? Avoid it altogether. Remember, firecrackers are explosives, not toys. Here are some safety tips. Leave fireworks to the professionals. Enjoy public fireworks displays conducted by trained pyrotechnicians. Never hold a lit firecracker. This seems obvious, but it's the most common cause of injury. Keep a safe distance. Even if you're not holding the firecracker, be far away when it explodes. Supervise children. Never allow children to handle fireworks. Section 8. Respect the boom. A final word on firecracker safety. Firecrackers can turn a celebration into a tragedy in a split second. The potential for severe life-altering injuries is real. By understanding the science behind these injuries and following safety precautions, we can help prevent accidents and keep our celebrations joyful and injury-free. Remember, respect the boom, stay safe, and keep those hands happy and healthy.